Unsafe conditions. Is it wrong to force medical professionals to work in strenuous conditions during the COVID-19 pandemic? Absolutely. But what is COVID-19? COVID-19 belongs to a family known as the coronavirus, which is known for the crown-like spikes on their surface. These are responsible for the common cold, flu, SARS, which stands for Severe Acute Respiratory Syndrome, and MERS, which stands for Middle East Respiratory Syndrome. Little is known about COVID-19. What is known is that it latches to the cell's ACE protein, which helps regulate blood pressure and spreads throughout the body quickly. Many victims have died from pneumonia, cardiac arrest, and even stroke. It is highly contagious, and older adults and people with pre-existing conditions are more susceptible to death. However, there has been a rise of COVID-19 deaths in healthy young people, including an infant and 5-year-old girl. COVID-19 was first identified in Wuhan, China in December 2019. By January 31st, 2020, the National Department of Health and Human Services declared a public health emergency, following the same declaration made by the World Health Organization, WHO. By March 11, 2020, WHO classified COVID-19 as a pandemic. At the time, there were 118,000 cases with 4,292 deaths worldwide. On March 13, 2020, President Trump declared a national emergency to combat the COVID-19 virus in the states. He recommended a national effort of social distancing and lower the infection rate. As of today, May 2nd, 2020, 70% of Americans remain locked down. Nationwide, the number of infections jumped to over 1 million, and over 66,000 people have died from COVID-19. At the time that the national emergency was declared, President Trump also made an impromptu national call for healthcare workers, signing into orders that allowed doctors and nurses to work across state lines. He also asked hospitals to activate the emergency preparedness plans and called them heroes and promised nurses and doctors in hospitals that the federal government would be right there to help them. He also considered hazard pay for healthcare workers and told them that they would be able to get the testing that they needed whenever they needed it. And he even made claims that he had ordered over 500 million N95 masks. But what actually happened? And what is actually happening now? Officially, there are over 9,300 U.S. healthcare workers that have COVID-19. Unofficially, these numbers are inaccurate because most healthcare workers can't even get tested, and they end up dying without officially being diagnosed. And hospitals are forcing healthcare workers to use the same PPE weeks at a time. Hospitals are also understaffed and refuse to hire more. And many healthcare professionals are not given mental health support during this pandemic. Reading some of the headlines reveal a huge irresponsibility on the hospitals in regards to safety and well-being of their workforce. Mental health care should be a #1 priority. Recently, Dr. Laura Breen, an ER doctor and survivor of COVID-19, committed suicide after being treated for exhaustion. And those who speak up about the poor conditions of their hospitals should not be denied care, as seen with nurses such as Lisa Elwell, Deborah Gatewood, Cecilia Benago, and Sylvia Leroy, who were all denied treatment after raising concern about the lack of PPE in their hospital. And unfortunately, all of these nurses died of COVID-19. But in speaking of nurses, doesn't Provision 2 of the ANA Code of Ethics for Nurses force nurses to work? Well, it does state that nurses' primary commitment is to the patient, yeah. But Provision 5 also states that nurses owe the same duty to self as to others. And even with these ethical codes guiding professionalism of the healthcare workers, these workers have a right to a safe environment. And these demands aren't outrageous. PPE is a necessity to continue combating COVID-19. And it is incredibly irresponsible for these huge hospitals to be paying their CEOs millions of dollars during this pandemic, but can't afford to pay anyone on their payroll higher wages or get PPE for them, let alone provide adequate testing for their employees. Okay, well, can nurses refuse to treat patients without proper PPE? Yes. And there are state laws that protect whistleblowers and workers from unsafe conditions, such as California, New York, New Jersey, and Pennsylvania. So why not just quit? Well, according to the Washington Post, as of April 16, 2020, there are more than 22 million Americans who have filed for unemployment aid. With that many people, it's hard to even get an application processed. And who can afford not to get paid for weeks at a time? In retaliation, President Trump suggested that the problem with the lack of PPE was because healthcare workers were stashing and selling PPE meant to keep them safe, which is a huge slap in the face of those who he called real heroes. They call this a war, but these workers are forced to work in worse conditions in the military. How do you expect the military to go to war without a bulletproof vest? You don't. So why expect frontline medical workers to work without PPE? Military workers also get mental health care during wars and conflicts. Why aren't we providing that for our frontline medical workers? And no matter the situation, a military member is obligated 5 to 8 hours of sleep. Why can't we provide that for our medical workers? As my resolution, I propose that we make them a part of the National Department of Health and Human Services during the national emergency. Under my resolution, all health care professionals would be activated as reserve members of HHS and given equivalent pay rates as those full-time active duty HHS employees. In addition, an activated reserve member will be given the same benefits of full-time HHS employees, with exception to full healthcare benefits. I do believe that healthcare benefits should be prorated for the time spent activated. In addition, hospitals will be activated as reserve entities, and the HHS should provide oversight. If they can approve healthcare workers to work across state lines, I believe that they can completely oversee the work done in each hospital. And CEOs would only provide guidance to HHS officials during the national emergency. Now, granted, my resolution isn't far-fetched. The military commandeers establishments during times of war, and the president just deemed this a war on an invisible entity. I believe with this resolution, the weight of stress that is put on a frontline medical worker will be lifted. With funding coming straight from the government, many hospitals can see improvement on staffing, work conditions, and proper PPE. In addition, frontline workers will finally get the hazard pay they deserve. Thank you for your time.